Today I'm going to speak to you about upper and lower lid blepharoplasties. In terms of what that procedure entails, blepharoplasty is a surgical procedure that we use to correct skin and soft tissue defects around the upper and lower lids. It involves removing excess fat, sometimes addressing muscle, and then sometimes addressing the tension around the eyes. Important here is to understand the anatomy of the eyelids. That's really the crucial portion here from the surgeon's end. We want to understand how the skin and the tissue behind it plays a role. We want to understand how the orbicularis, the muscle that goes around the eyes that helps us close our eyes, plays a role. There's an area called the tarsal plate that helps suspend the eyes, almost like a hammock. Then there's our orbital septum, which is that separation between the fat and the muscle and the tissue, as well as the fat pads and where they sit. Understanding that anatomy is crucial in this operation. We have a drawing or a figure behind me. In terms of surgery and who is a candidate or what are indications for a patient to undergo this surgery, let's start with the upper eyelids. Most often I'll see patients that come in and have requests with regards to their upper eyelids because they have some excess skin, some loose hanging skin that may or may not obstruct their visual field, meaning that they can't see as smoothly, and also overall just aesthetic concerns. With regards to lower eyelids, it's more important to keep in mind sometimes patients for lower eyelids have excess tissue and bags under their eyes. That can be related to the fat bulging, or it can be related to something that's family related and a functional aspect there. Wrinkles and sagging skin are crucial in this circumstance. If we have a patient that may be indicated for the procedure, what are some of our preoperative considerations or thought process that we run through in this circumstance? Well, as a physician, it's always important to take a pertinent and a very thorough patient evaluation of medical history. We want to indicate any issues with regards to bleeding, bruising, things that are called dry eye syndrome that may lead to complications or issues after the procedure itself. We discuss with our patients their expectations. This is crucial. Some patients are candidates for this procedure where they can see substantial improvement. Some patients may see some more modest improvements. It's important to have that conversation early on. We also have pre-surgical instructions. We want them to stop any medications that will increase the risk of complications after the procedure. In terms of surgical techniques, when it comes to the upper eyelids really tend to be a location that we can often manage if that's a patient's only concern in the office under local anesthesia. That's important, right? Doing a procedure under local anesthesia, patients recover, they'll be home that day, short period thereafter. They really do get to go about most of their normal routine within the next 2 to 3 days. They have some bruising that after about 72 hours can be covered with makeup. And honestly, the recovery is pretty smooth. In terms of an upper lid procedure, or an upper lid blepharoplasty, the incision is often placed in a crease in the eyelids that we identify at the time of surgery. I'm able to remove not only the skin, some of the musculature, and if need be, not as often as we once did in the past, a little bit of fat that's involved in that location. Then repairing the area with some fine suturing really does help create the aesthetic that patients are looking for in this circumstance. Lower eyelids. Those are more complex, those are more involved. They often require either some form of general anesthetic or deep sedation where the patient is thoroughly under anesthesia because it's a bit more discomfort for our patients. In that setting, we're able to access the eyelid through either the skin or at times inside, called a transconjunctival. So we have two options. There are incisions that go right underneath the eyelashes in the lower lid, or we can go within the actual eyelid and hide the incisions entirely. Different patients are different candidates for different procedures in that circumstance. Crucial to the lower eyelid is to be very judicious and cautious with the amount of skin we remove. The effort here is to reduce the risk of post-operative headaches or complications where the eyes may pull a bit. There are treatments for those, but if we can minimize or reduce that risk in the perioperative phase, better to do that. During the lower lid blepharoplasty, the goal here is to really achieve some improved aesthetic. One is to tighten the skin if needed. 2 is to remove fat if indicated. And 3 is to reposition fat to a location where it better serves the patients. Meaning we want to blend what's called that eyelid to cheek junction so we have a much more natural aesthetic in that setting. That procedure takes a bit longer than the upper lid blepharoplasty, normally about 45 minutes to an hour for upper lids, about an hour and a half, possibly 2 hours for lower lids when done properly. Patients still go home the same day, but they do vary in terms of anesthesia. Of course, these two procedures can be done together at the same time, and patients do exceptionally well in that circumstance. In terms of the post-operative care, what you can expect. Cold compresses are used early on for limited periods of time, but this helps reduce swelling. We avoid strenuous activity, no lifting, pushing, pulling. We will be given prescription eye drops and ointments, and usually patients follow up within the first 72 hours to keep an eye on how they're healing. Complications that could be associated with this procedure might be some swelling, some bruising, dry eyes, which we've often identified prior to the procedure and may need to manage at the time of the procedure. Sometimes there's some imbalance that may need required addressing, but very rare in those circumstances. Please enjoy some of the before and after photos.